It's noon. Let's get started. Hi, everybody. Welcome to our Graduate and Online Friday Career Connection. Thank you for joining us. Um, my name is Tad Brinkerhoff. I'm the Associate Vice President for Grad and Online, and the purpose of our podcast Zoom call today is really to talk about careers and how people manage their careers, but also we wanted to look into the inside of an industry. And today our theme is healthcare. We're very excited to have Selwyn Layton here with us, who's a professor of nursing and also a practicing nurse practitioner as well. So I don't want to steal his thunder. So what we're going to do is we're going to turn some time over to Selwyn to really talk about his career journey. And as you know, we may do a snap poll or two during the podcast. And then I have some questions for Selwyn, but also welcome your questions as well. And Selwyn, before we turn the time over to you, I'd just like everyone just to post in the chat where you are physically located right now, both the city and the state. If you're coming from outside the US, let us know if you're in a different country. That would be great. So you just take 1 minute to type where you're physically located. That gives us an idea um, of where you're located. Also, if you're a registered nurse, can you put that in the chat as well? You can just put RN. I would love for someone to see if we have any registered nurses in the audience. Oh, we have one RN. Hooray, hooray. So we've got Saratoga Springs, Prescott, Arizona, Southern Utah, Cortez, Colorado, Cedar City, Cedar City, Cedar City. Three RNs. Nice. I talked to an RN yesterday that's a Selwyn fan.
Oh,
Uh, she said, I want to come. I hope she shows up. We don't have an RN. We have someone from Logan. Great. Okay, we'll keep those responses in. We're going to go ahead and turn the time over to someone. We want to hear about his career journey from his time in school to how he chose to become a nurse and a nurse practitioner, and then a professor. And then we'll have some conversations about healthcare, the nursing field, and how you manage a career, especially in healthcare. So, Selwyn, we'll turn the time over to you.
hey, thanks, Ted. To just start with, I am originally from Battle Mountain, Nevada. I was one of the few babies born in Battle Mountain. Most everybody had to travel the 50 miles or so to Winnemucca to have their babies. So, and I was a breech baby. So as I tell my mom, was born with my feet on the ground and running. And she said, well, that means my head was in the clouds. So
We're
um,
starting really early.
really early. I came to Southern Utah to actually work on business management and biology with a pre-med. Um, I got married along the way. My wife started working down in St. George 2 years before I graduated. And we really didn't have that conversation of what are we going to do afterwards? And as I got closer to finishing up my biology degree and I had finished my business management degree, she said, well, whoa, wait, I just started my career. I'm 2 years into my career. We can't just up and move and go somewhere else. At the time, I was working as a CNA for Iron County Home Health. Marie Prince, who came to Southern Utah and started the first home health agency here. And she literally started on a bike riding around to people's homes. And that's how that agency came about. And I worked as a CNA for her. I did that for about 5 years. Just loved it. Loved the patients, loved that connection. And one of the things I realized as I was watching nurses in the home health agency work with the patients, they were the patient advocates. They were there for the patients all the time. I would see physicians write a quick note based off of what nurses were telling them. So really, the nurses were driving the healthcare. It wasn't really the physicians. And I said, oh man, maybe I need to rethink this. So I started going back to school to get my few prereqs that I didn't have for nursing. And about that time, I had a friend that was going down to PA school at Toro University, Nevada. And he said, "Come down to Toro, you can be a PA." And I thought, well, maybe that's the way I need to go. And I went down to Toro with unofficial transcripts to meet the director for their PA school. And on the way out, I met Sue Ulrich, who was the director over the new nursing program that was coming to Toro. And she talked me into coming into her office, and we sat down, we're just talking. And I showed her my unofficial transcripts and talked about, that I was going to be taking the GRE and all that fun stuff and applying to PA school. And she goes, "Well, Selwyn, nurses do more. And in the end, you can be a nurse practitioner and you're gonna give your patients quality care and this and that. And next thing you know, we're shaking hands over her desk, and I'm gonna come to Toro for nursing school. And at that point, Toro had a very specialized program. In 1 year, you get your bachelor's degree, and in the second year, you get your master's degree. And so I actually signed a contract with her saying, I won't work during those 2 years. I'm going to eat, breathe, drink, nursing, live that healthcare experience. And so, literally, from Monday through Friday, from 7 a.m. to 7 p.m., I was either in the class or in the hospital doing clinicals. And during that time, I would travel from here in Cedar down to Toro. I would stay with a cousin during the week, and then I would come back on the weekend. So I say to my wife all the time, it was like we were dating all over again. I'd call her on the way to nursing school. "Hey, what are you doing?" You know. So it was kind of an interesting period in our early marriage. Um, but I got through that and came back to Utah. Well, I worked for a couple of years at UMC, traveling back and forth. Worked on the medical surgical unit down there. If you guys don't know UMC, it's the state hospital, one of the state hospitals in the Vegas area. And it's right downtown. It's a pretty dangerous area. We would go into a secured parking area. And then when we'd come out, we all gathered in one area, and a security guard would walk us nurses and the techs and the doctors and PAs and everybody. They'd walk us into the hospital at that time. I don't know what it's like now, but there was muggings, there was different things that would happen, so they'd keep us protected that way. And the
So,
same thing, we would gather outside to go to the parking structure just outside the hospital, and then they'd walk us back to our cars.
Selwyn, was that right after you finished your master's?
That was right after I finished my master's. And
Okay.
then from there, I got a job at St. George Hospital. It was Dixie Regional at the time. And I worked for about 2 years on the cardiovascular unit. And then I was trying the whole time to get back into Cedar Hospital. And so in that transition, Cedar Hospital used to be up behind Smith's on the south end of town. And they had transitioned to a newer hospital and larger, and they were hiring more nurses on the north end of town. And it was Valley View Hospital at the time, and now it's Cedar Hospital. So with that transition and um, adding more jobs, I was able to secure a job in the ER. And I worked in the ER. And actually, I noticed Aaron Elliott. I met Aaron when I was new at Cedar Hospital, and um, I he kind of trained me a little bit, and so it's kind of cool to see him on this call right now. But I would work 3 days a week, 36 hours a week, 3 12s, and then I'd have 4 days off. And I was thinking, what in the world am I going to do with this master's degree? A couple
So,
years into there, one of my colleagues or one of my the staff members that I was working with said, "Hey, there's a job that opened up at Southern Utah University, and they're looking for nurses with master's degrees. And if you all know, there's not a lot of nurses with master's or doctoral degrees out there. It's becoming a little more prevalent, but the percentage is pretty low, which has set us up to have careers if you have a master's or higher in education field. So I went on a whim and applied, thinking, I won't get it, but it'll be fun if I do. Next thing you know, I get a call saying, hey, come to Southern Utah University. So we have a policy in place for what we call our leave rank tenure policy that says you still need to work in the healthcare field while teaching full time at the university to keep your license current. And that's kind of morphed over the years, but it's still, we keep that pretty close. So I would work on the weekends in the ER still, and I would teach during the week. And so pretty much during that 9 month contract period, I would have about 2 days a month off. And I and I didn't care. I loved it. I loved it. But it did wear after a while, and I moved over to a house supervisor PRN position. PRN meaning as needed. Um, and so when a shift would come open here and there, and I would take it, and the only requirement is that I have to get 200 hours a year to keep my RN license current, which isn't hard to do when on a 9 month contract because you have the summers available. And
So,
then, yeah,
so was your master's at Toro? Was that the nurse practitioner degree?
it was not.
Okay,
And,
so
it's interesting. I bring this up because um, the first one was in nursing administration. And I bring it up because if I would have known at the time, I would have streamlined into a nurse practitioner master's. But I didn't know at the time what I didn't know.
yeah.
Um, so, for those nurses that are wanting to be managers and wanting to be directors of nursing, masters in nurse leadership and masters in nurse administration is the way to go. It really is. But for me, I was so interested in still having some of that bedside care, and I was still so interested in teaching and bringing that to my students. A nurse practitioner would have been a better way to go to begin with.
Let me ask you this question. At what point in a nurse's career do you think it's optimal to move into nursing administration? I would assume you
Yeah.
need some experience, but what would be your recommendation for those nurses who want to move into leadership? Where in that career pathway should they look to do that?
I really feel like a good 5 years. So they start to get to know things, and during that time become charge nurses.
Okay,
A charge nurse is kind of that mid-level between the staff nurse and that nurse manager, where the nurse manager they're off doing some other things, so the charge nurse has to know policies. They have to the staff can come to them for help, and they start to build that understanding of the managerial side of things, right? And part of that is FTEs, full-time equivalents, and understanding how many of these people do I need to bring in versus not bring in. Um, so I would say a good 5 years really gives them a good grounding to move up into a managerial position.
yeah. So a charge nurse would have direct patient care, but a nurse manager would not. Is that correct?
Usually that is correct. We do have some nurse managers. So, for example, our nurse manager, Jake Fawcett, that's still in the ER, he still covers once a week. He gets
Hmm.
in there either day or night and covers to make sure that um, his his staff know he's there for them, which is very unique because most nurse managers, once you're that busy, you don't then take a shift on the floor.
Gotcha.
It's really hard to do.
Okay, thank you. Okay, I'm waiting with bated breath on the nurse practitioner chapter.
So the funny part is I got my doctoral degree, DNP, in leadership before I went back and got my nurse practitioner. So in 2014, I went through Capella University and got my doctoral degree. And the reason behind it was the university side. We didn't the our CCNE accreditation body was saying you guys need doctoral prepared faculty. And this is a problem. And moving forward, at some point, if you guys are not getting those some doctorally prepared faculty, you could put your accreditation in jeopardy. So Dr. Donna Lister, who was our department chair at the time, myself, Dr. Kevin Tipton, we all went back to school and got our degrees. Now, Donna Lister went the PhD route. I went and Dr. Kevin Tipton went the DNP route in leadership. Um, and so we did that. And then in 2016, I said, man, I really want to get back into more of the patient care side. Because by then I was covering as a house supervisor, which is a managerial position. You have very, very, very limited patient care. So I went back to school, and in 2018, I graduated with my nurse practitioner.
Wow. How many degrees do you have? Four?
So I have, yeah, I have two bachelors, two masters, and a doctoral degree.
That's
So
amazing.
so if I have anything to say to anybody, come sit down with me so I can save you time and money.
Yeah.
Right? Let's talk about the path you want to go. Otherwise, you're just putting out money. There's a lot of things that I learned along the way that nobody sat down and said, "Hey, why don't you think about going this route?"
Yeah. So we had a question come in. Someone said, so where in that process would you have recommended getting a master's degree? It sounds like if you want to go the
Mhm.
managerial route after 5 years of hands-on nursing experience, what about like if you want to go the nurse practitioner or the
Right.
PA or med school route? Where in that process would
Mhm.
you recommend?
And it's interesting, Tad, because a lot of our programs and a lot of these programs out there, we take nurses with a year's worth of experience. However, with that being said, I still look at a nurse practitioner as about 5 years. If you get a
Okay.
good 5 year bedside, you're going to understand your medications, you're going to understand some of the legal processes and stuff that you just don't know that you don't know when you first graduate. You're going to be able to understand disease processes better and pull in that pathophysiology, which is huge. It's your base in order to start assessing your patients. And if you don't understand those things, you're not going to come to the right diagnosis. You're not going to come to the right treatment plan, and your patients are going to fall out. And we see this really in the literature right now as you look at our nurse practitioners coming out of school and where they're at. We have the best outcomes out of any practitioners. We have the least malpractice lawsuits out of any practitioners. So we're talking MDs, DOs, PAs, so on. So
And
that tells you if we get that good base, we're going to give great care.
yeah, that's interesting. Well, I think one, the hallmark, my wife's a nurse, I got two daughters that are nurses, but I'm not. But it seems interesting that the SUU curriculum is very hands-on, very personalized. My daughter who went to the SUU program talked about knowing you, knowing Susie, and knowing other professors, and how that made a huge difference in her educational journey as a nurse.
Well, one of the things I noticed too, Tad, with SUU and the nursing career is all of us professors. If you notice, I don't say, "Hey, call me Dr. Layton." "Hey, call me Professor so and so." I tell the students, "Hey, we're going to be colleagues. We need mutual respect, but call me Selwyn." Same thing with my nurse practitioner students. I say, "Call me Selwyn. We are colleagues. We work in the field together, right? I may be teaching you certain things, and we need to have that a certain level of respect. But at the same time, if we get together on a first name basis, you're going to be more comfortable to come to me, right? You're going to be more comfortable to sit down with me when you're struggling so we can figure out XYZ to help you through that educational process. And that's what I find with all my colleagues at SU Nursing.
I like that. That's great. So you finished your FNP, you're continuing to teach. How have you
Yep.
kept active in the healthcare, the patient direct care?
Yeah.
I've heard you're an entrepreneur of sorts as well.
Yeah. So I have my own concierge business that I started. It's called Black Bag Concierge. Black Bag, just like the doc from Little House on the Prairie, right? So I literally take my little black bag in, and it has little embroider BB for black bag, and I sit down with my patients. I see them. I love it because where I'm at with mine, my practice, I practice. I have time for a half hour, an hour for each patient and really get into the depths of things. We see that most of our regular medical models, when you go into a clinic, the doctors will see a patient anywhere between 5 and 15 minutes.
Yeah.
You can't get your finger on the pulse when it's happening so quick, right?
Yeah.
So it's almost like a mill. So one of the things that I wanted to change was actually get to know my patient medications. So let's go ahead. Let's go into your home. Let's pull out the medications. Let's look at them together. My heavens, I had a patient just was complaining, I'm so dizzy. I just had taken her on. We sat down, started looking. She's like, I just can't stand up during the day. I'm having falls. She was taking three blood pressure medications, actually, the same blood pressure medication from three different physicians. So, we're running systolically in the 80s. Well, yeah, you're dizzy. Let's eliminate this one. Let's eliminate this one. Keep the one from the cardiologist. You're not going to take these others. And my goodness, her blood pressure came up in the teens to 20s, and she hasn't had a fall since, right? And she's been a patient of mine for 3 years now. Actually, they also told her that she was only going to live 6 months. I had to take her off palliative care. So,
That's incredible. Yeah, that it makes a difference, the right med mix. So a
right.
nurse practitioner in Utah can function independently, and it varies from state
Yep.
to state, correct?
It does vary state to state. We have more and more states that are that are putting in their House bills a section to give autonomy to nurse practitioners. So
Yeah.
you're seeing that more and more.
So is this, I've seen there's these subscription models. Is yours a
Mhm.
subscription model? Or
So
you
mine's set up two ways. So one is a subscription model. They pay 125 a month, and I come monthly and see them and help manage their meds. And a lot of these patients, you have to understand when they say our insurance and medical model is broken. A lot of these patients, you think, well, 125 a month, almost 2 grand a year. They were paying 5 to 10 grand out of pocket,
wow.
right? And so I've eliminated all that. So when we're ready for medications, I have my own, or lab draws, for example. I have my own lab draw company, not my own, but one that I go through,
Right.
and that's covered in their concierge. I set it up. We go draw the labs. I send it off to the lab, so that's covered in there. So there's simple things like that. There's sometimes that we have to go above and beyond. So yes, they may have to pay a little bit more, but those are rare instances. Um, and then the other portion of that is the chronic care management. So I am what's called PACO certified through Medicare and Medicaid with my national provider index number. And so people that are 65 and older, Medicare and Medicaid pretty much pay for the gamut of things. They're very different than these other patients. Where these other patients, you go in, you get labs taken at Intermountain Healthcare. The The insurance picks up XYZ and they're paying still $500 to $1,200 out of pocket after insurance, right? Where with me, they paid $50 out of pocket or none, depending on if they're on that concierge. With the Medicare, Medicaid, usually they cover it. As long as I code everything right and say this is exactly why they need these labs, they'll pay for it. The thing is the 65 and older, you have to have two chronic conditions that are going to last 12 months or longer.
Yeah.
So,
How did you, I mean, it just seems overwhelming from a business perspective. How did you figure all that out? And do you have a business manager that works with it, or do you handle all the business side as well as the medical side?
well, luckily for me, I had business management and
That's
then I
right.
had
That's right.
nursing administration. So, but I had to do my groundwork. So I had to reach out to, different places in the state to say, is this legal? Is this legal? Um, and then I went to a couple of conferences where they were showing how to set up some of these businesses, which really helped. But yeah, the majority of it I did myself, and it's a lot. It's a lot of legwork, but it's worth it, especially for your patients to see good outcomes with them.
Yeah, that's interesting. Okay, I want to do a quick snap poll with our audience. Those of you who are nurses, would you consider setting up something similar to Selwyn, where you're an entrepreneur providing subscription care? Would you just reply, yes, I'd be interested, or no, I want to stick with the um, traditional hospital or clinical setting? I'm just curious because I'm fascinated by this model and the what I've read about subscription health. We've got two yeses, which is interesting. Someone's already doing it and scaling it. I love that.
Nice. Yes.
Someone
Perfect.
said, yeah, I'm not interested in running a business. Too much administrative work. Yeah, okay, that's interesting.
There is a lot of administrative work, but with the tools nowadays, there's a lot less too. So, for example, I have an app on my phone that I turn on before I leave the house. It tracks all my mileage. So at the end of the year, I just download. There's a quick download Excel sheet, and I send it to the CPA. Same thing with some of these other things. There's apps that will actually track it for you, and it makes it way, way, way more manageable.
Yeah.
So
Interesting.
your expenses and all that. So.
So, what do you think the future will be of Black Bag? Are you going to get a partner? You want to grow?
So I would like to grow it. I would like to at some point bring on some other nurse practitioners that want a little bit more autonomy and freedom. Because that's the nice thing about that as well is you can set up your times. Um, and you think about it, well, they're paying 125 a month. That's not too shabby for a nurse practitioner. Um, and so yeah, they can make a good living at it, so yeah, I would like to see it grow. One of the things about this model too is with the traditional model you're beholden to the insurance companies.
Yeah.
So when I was working with palliative care as a nurse practitioner, I did that for about a year and a half down in St. George. And I love them. Pathways, hospice, and palliative care, they're awesome, but you're beholden to the insurance companies. So you can only order these labs. And even if you need to get another lab draw within 6 weeks because something was off, they won't pay for it. So then your patients are in at $1,200, $1,400, which is
Yeah.
so interesting to me because then, Tad, I can order the exact same labs, send it to the lab that I go through, and they paid $50, right? And or with the concierge fee, we just cover that portion.
So everybody's paying out of pocket for those labs.
Yeah, yeah,
Yeah. Well, with the way insurance is going, I think you're right in a sweet spot. So,
Yeah, yeah.
um,
People don't trust the healthcare system the way it is anymore.
yeah, it's so complicated. Hey, we had
Hmm.
a question come in. Actually, two questions come in. This one was asking, any idea if a concierge service would be possible for orthocist or prosthesis? If I hope
Pros
I'm saying that right.
Yeah. So orthotics and prosthetics. So there are some out there for that. I don't know how well that model works, but I know that there are some concierge out there for a business like that.
Yeah.
So
So are your services in the concierge part, are you just coming general care, correct?
yes. So I kind of have it molded into functional slash medical. So a lot of times I will start patients on maybe more of supplemental side. And if that doesn't seem to be working, and change the diet and health and all that. And if that's not working, we'll start moving more towards maybe, for example, my diabetic type 2s, the GLPs and things like that.
Yeah.
So we'll kind of mold it to what they need. And a lot of what I end up doing is sitting down with them and saying, okay, let's look at these particular diets, see what's going to work for you. Let's look at this particular you know healthcare plan as far as getting out into the gym or walking or whatever it may be on that physical side of things. So I'm working a lot with patients that way too. Now, don't get me wrong, because for example, I had a patient that I just did pellet implants. Pellet implants are hormonal implants like testosterone, estradiol, so on. And insurance doesn't cover them. But the funny part is, even though insurance doesn't cover them, they have been proven that in particular patients, especially like if they've had total hysterectomies, total thyroidectomies, instead of doing daily creams and daily shots or weekly shots, to do an implant every 6 months, right?
Hmm.
And they'll go in to the endocrinologist who will charge them thousands of dollars for those implants, right? My patient, they pay cost for the pellets, so you're talking $20 a piece for the pellets, and the rest is covered under my concierge.
Wow.
So
That's
where she
fantastic.
was spending about 4,000 a year, now she's just spending about 2,000 with my concierge.
Yeah, I love that you found an innovative way to kind of solve a problem. We've got a question from Juliana. She's curious if your education included the analytics of scalability and sustainability. I've studied each and currently working toward an MSBA.
Hmm.
Curious if your education included that.
So
I
Does
was
that make
just
sense?
wondering more of like, is that something that you are going to have to outsource, or is that something that like your education already covered it? Because you did say it covered a lot of the like managerial side of things. It's just
mhm.
I'm working towards mine in business analytics, and I've worked in healthcare for over 5 years. So I just was
Yeah.
curious, like your level of involvement with the numbers side of things.
So I mean, for a small practice like mine, I'm doing it right, and I've been through, I've had all those classes. I can keep the books. I can look at all that. But the answer is, if I get 5 employees or more, I'm going to have to bring somebody in to help manage that, right? Because then you're growing. I can't just manage everybody's time and what they're bringing in, and yeah. So at some point, as I scale that up, I do have to have somebody um that would do that side of things.
I guess my follow-up was more of like also, are you hiring? Like I
Am
just
I hiring?
jokingly,
Well,
yeah, I just
I
mean like
haven't
if you are
yet.
looking for that, I know that like
Hmm.
my class for the MSBA usually only has like 10 people in it. Like not many people are working towards that. I
Right.
initially was working towards like MBA with the emphasis on business or
Hmm.
healthcare. And so I chose to do more the analytical side because I didn't want the managerial side, but just like
Right.
I think that because you like have used SU as a resource before, I'm sure that there are plenty of like a lot of the professors that I have are like posting positions and like letting us
Hmm.
know like the positions that we would be qualified for as people who are working towards that degree. Because like I'm about a
Right.
year out, but like most of my experience is not related at all to analytics. It's just in healthcare. And so it's
Right.
hard trying to find that transition. And so I just was curious, like, at what point do you think you'd want to scale and like increase that to involve more areas rather than
Yeah.
just having the current like locations that you're at, which is why I followed up like, what areas do you cover with your
Right.
services right
Yeah.
now?
Yeah. So, lot of questions there, but yeah. So, at some point, yes, I'm going to be looking at hiring um, s- somebody to manage, bringing in more nurse practitioners. I haven't quite gotten to that point yet, but as I expand out, it's most definitely coming. Maybe faster than I think it is too. Um, but the other side of that, you were saying that what other areas do I cover? So all that I
I meant
cover
like
right now,
location wise, like I
right?
meant like,
Location wise is all at patients' homes. So I actually go
okay,
out to their homes, but
I meant like geographically, like I'm in Salt
oh
Lake
yes.
doing the program online. So I just was wondering, is
Mhm.
it specifically like Cedar City, Southern Utah, or like
Southern
what?
Utah.
Okay,
I do
that's what I
have
was
some
curious about.
patients down in St. George and actually Silver Reef and Leeds as well. So it is expanding out, and as I do that again, like I said, I'm going to have to bring others on and have
That makes sense.
somebody work on the books
Yeah.
because I just won't be able to do that at that point.
That's so have you considered like partnering with existing companies regarding the testing? Like that's something I followed up with. I work at AUP Laboratories
Hmm.
and all of the people, like it's a family health clinic for all employees where the testing's free because it's in-house. And I wonder
Uh-huh.
if maybe partnering with a company like that where you could like mail the samples or something, or is it just you want it to be
Right.
more direct
Well,
of like the resources you already have
I like the more direct right now. I don't know what that will look like as
as it
business.
scales and stuff?
Yeah,
Yeah. That
yeah,
makes
that
sense.
may
I just
that
I
may
like
have
your
to
concept.
change.
So
And
I like the idea of it. It's just that I focus more on like I work with testing the samples,
mhm,
not like the patients themselves.
right,
And
yeah,
so, but there are people that do like the phlebotomy and like other parts of it. And so
hmm,
I was just curious if you considered like partnering with a company that has like ARUP is a national reference laboratory. It's like
yeah,
finding a company that's that way you can expand your locations and have a universal system already set up where you're
right.
partnered with a company rather than like you needing to be the whole company start to finish. But I was
Exactly.
just curious.
And again, because it's so small right now, I haven't had to go to that point, but
That
I
makes
have
sense.
thought about that as
Yeah.
the business expands. I probably am going to have to go to a model like that just because,
Yeah.
scalability, it just doesn't make sense to go so far
To
out
just
and
do like
not.
one local and
Mhm.
not have, because then you
Yeah.
can't go further than that if it's just a small local business you're running through.
Exactly.
I was thinking maybe it also would help as like a perk for your employees as like a similar thing. I'm sure if they partnered with you, they'd probably do something like, oh, your employees are also technically kind of our
Right.
employees type of
And
thing. And like
and
stuff like
even with
that.
employees, a lot of times with nurse practitioners, right? We bring them in as independent consultants, basically, right? They're
Yeah,
1099s. We bring them in that
that
way.
makes sense.
So,
Yeah.
Oh, okay.
Hey, so
Well, thank
thank
you.
Juliana, thanks for your question.
yeah,
Hey,
it's a great
Selwyn, can
question.
we've got about 10 minutes left. I'd like to
Uh-huh.
get your opinion on AI in healthcare. What you're observing,
Hmm.
how do we prepare those folks that are in healthcare, how do you handle AI? How's it going to change the field? How do we prepare for that
Yeah,
as
it's
healthcare
a
workers?
very interesting conversation right now out there with AI. Um, so I like AI for things such as we used to, well, and we still do, like in the hospitals or with patients. A lot of times we're pulling out whatever we are and going through it electronic, or they're in the hospital, they're typing on the computer, and you're not looking at your patient, right? And that takes away that personalization with your patient. So one of the things that I say to my patients, I have Get Freed, and it's going to scribe for me, but it's not the ends all, Tad, because every time I go to put that in my EHR after, I've still taken some mental notes and some of my own little notes because it never gets it 100% correct.
Mm.
So I always then upload it into my EHR and read through it, but it saves me time. And that's the great thing about it. The thing I worry about it is, especially on our student side of things, like our nurse practitioner students, I hear them talking about that they see other practitioner students from other universities using this, right? I want our students to know their patho. I want them to know their assessment skills. I want them to know their diagnostic skills and that they're thinking about those things. AI can help go, oh, yeah, here's another little thing to think about. But if you're not thinking and have those skills down, you're missing the boat with your patients, right? Um, and that's the hard part about it. So, for example, the other day I'm watching my son's band concert, and literally a kid just fell over.
Mm.
Interestingly enough, myself and Dr. Miles from the ER was there, so we hauled him out. The concert went on, and we took care of him, right? And we went through those skills. We didn't have AI at our fingertips right there. We didn't have anything else except what our knowledge is and our experience is, right?
Yeah.
And that's where AI kind of gets scary because if we're relying too much on it, if something like that happens, what are they going to do?
Yeah. Yeah, I had a colleague in Pittsburgh. He was a physician as well as he had a master's in computer science. And he started a company that was using AI to diagnose pancreatic cancer
Mm-hmm.
much earlier in the process. And it's really he
And isn't
really
that cool stuff?
yeah,
I
he's
mean,
done well. So he's like feeding all that data into a model that
mm-hmm.
predicts if you're going to get pancreatic cancer much, much earlier. And I don't know much about it, but I'm just fascinated by that. Uh,
Yeah. And there's a lot of those tools coming out, and I'm not averse to using those tools.
yeah.
But what I am saying is we still have to use our minds.
Right. People still matter. So
People still matter. Yep.
yeah. Okay, that's helpful. What advice would you have for someone who is currently working towards a career in the healthcare field or who may be considering it? Someone who's just starting out and all the things
Mhm.
you've learned about your experience in your education. Um, what advice would you have for them to build a successful career in healthcare?
Well, like you heard me say, if I would have sat down with somebody early on, it would have saved me time and money, right? I would have went the nurse practitioner route to begin with. I'd have gotten my DNP. I would have been up and rolling. I didn't do that. So one of the biggest things I say is find somebody, whether it's healthcare administration, whether it's nursing, whether it's MD, DO, whatever it is, find those people, sit down with them. I I can't tell you how much our career coaches at like Southern Utah, and I know there's other universities that have, maybe they don't call them career coaches, but they have somebody that can sit down with you, and it doesn't cost you a dime.
Yeah.
And that information is invaluable to help you set up and then set those goals of where you want to go.
Yeah, interesting. So, and as you've shared your story, it's been pretty obvious that the network you've created, the relationships that you've made, have made a difference in how you've made choices from deciding to go to nursing school down at Toro. Talk a little bit about how you develop relationships. Do you do that intentionally, or is it just who you are as a person? And how should someone go about building the kind of
Sure.
relationships that help them be effective?
So, Tad, it's interesting because, like, for me, and I think I saw Susie Campbell, our department chair, on here. I'm a talker. I'm a people person by nature. I am very much like my mother. right? My father doesn't say boo to anybody. They think he's mad all the time. He's just very introverted, right? So those are the people that they have to be more intentional about building those relationships. I've just gone out saying, you know what? Everywhere's networking. You never know who you're going to meet. I met a wonderful lady one day at the gym, talking to her. Come to find out, she's a real estate agent. Well, what does that have to do with healthcare? She knew business and she knew how to use YouTube. So one of the things I've been doing is taking these mental notes and asking her questions as I get ready to put my concierge stuff up on YouTube.
Wow.
So I mean, there's a networking piece right there that you just don't know where you're going to meet people to
Yeah.
network. I another guy at the gym that I met, I have 5 patients through him now. So you just and it was just talking. This is what I'm doing, and letting them know, hey, this is how I'm saving money for these patients that are actually needing healthcare and needing these things, right? And I know, like the healthy young teenagers, they're probably going to go, nah, I don't need a concierge model. I just need that doc once a year to do my yearly well check, but not everybody's there, right? There's a lot of
Yeah.
people that need more than that. So,
I,
and
I yeah, I think it's going to be a disruptive technology in healthcare. I can
yeah.
see. Okay, we got one question from Jonathan, and then I have another question for you.
Mhm.
Did you gain something more from the route you took? Let's see. Did you gain something more from the route you did take that you wouldn't have otherwise?
Yeah, of course I did, right? And I always say the good Lord leads you in directions that you never knew. So, um, but some of the things that I gained was a knowledge in the leadership and administration to be able to open up my own practice,
Yeah. Yeah.
right? I wouldn't have had that. I would have gone straight into nurse practitioner. I'd probably be working in a clinic, which would be great. And as we heard today, there's some that they prefer that, right? You take a self responsibility when you become the owner and the boss, and so there's that higher level. Another thing that I learned is growing a thicker skin, right? So it's one of those things that you just don't think about. And us nurses, we're empaths by default, most of us, right? So we have this empathy and we want to people please. And so by going that route, I started to realize I just can't please everybody.
Yeah.
And I'm never going to. So I need to be me and not worry about that and not ruminate on these things.
Yeah.
So just little tidbits along the way that I would have never gotten otherwise.
Yeah. And so and that kind of leads into my last question. What's it like being a male nurse? You're a big, strong guy, masculine guy in a very I would say it used to be a female dominated profession. How has that been for you? Has it
Had
been a
when
positive
I
thing?
Yeah, when I started, I think, and Elliott can attest to this. That's on this. We were about 1 to 3%. That's all. So when I started, they were big on, oh, well, you must be this and you must be feminine and you must, and it's like, no, we don't have to be,
Yeah.
right? And that helped me grow a thicker skin too. Just let it roll off. Don't worry about what others are saying,
Yeah.
because it really helps. Really helps us along the way to realize we're still there for people. We're still helping them. And I've seen nursing care change over the years. We've taken on a lot more responsibility and roles that MDs and DOs did back in the day to where we're at now.
Yeah. So interesting. Okay. In the 2 minutes that we have, tell us about why someone should consider a nursing program at SUU.
Yes. SUU, I can tell you this much. I went other places. I didn't get my nursing degree at SU, and I wish I had. You get more hands-on experience than I've seen anywhere else. Your professors care about you, know you on a first name basis, which is amazing, right? I mean, I loved my nursing professors, but it wasn't a sit down and talk to them unless you were trying to work on a grade or something, right? Um, we are rigorous. We hold you to a higher standard. But as you see that, I mean, most of the time we're in the 90s to 100% on our NCLEX pass rates, right? So far, it looks like the majority of our first FMP students coming out are passing their exams the first time. And that's not just by default. That's careful study, understanding what to put in the program to make sure they're successful. So, for example, SUU at the end of their 2 years, they're using the Hearst review, and they're getting that extra little bit of this is what's going to be on the test, plus this is what you got through those 2 years. And the same thing with our FMP. We're using the APEA, which is like the Hearst review. And so they are reviewing everything they got through the program and getting that little extra of what's going to be on the exams. So that higher level is what I'd say sets us apart.
Yeah, perfect. Thank you. This
Yep.
has been so fascinating. We appreciate all that you do for students at SUU. I love that you bring in both educational and practical experience in how you teach, which I think makes a huge difference. So thank you for your time. Just a reminder to those of you who are participating, if you haven't joined our LinkedIn group for the Graduate and Online at SUU LinkedIn group, please do so. We do a drawing every month, and we provide a hoodie or a sweatshirt to two lucky people who joined in the previous month. So if you haven't joined, do that so you can be eligible for the shirt. Upcoming, we're taking a break next week, but we have a well-known actor that's going to be part of our Friday Career Connections. We have an FBI agent, and we've got some really exciting people that have fascinating careers like Selwyn. So thanks again, everybody. Have a wonderful weekend, and we'll see you next time on Southern Utah University's Grad Online Friday Career Connections. Bye-bye.
Thank you. Bye.
Selwyn, that was awesome. Thank you.
Hey, thanks, Tad.
You're
Appreciate it.
I would call you a Renaissance man. You do it all.
I I think that's just nursing for you because any of our faculty, you know that, right?
Yeah.
They're all doing it all. So
Yeah. No,
yeah.
I just love that you've got the all the degrees, you're a professor, and that you run a
Mhm.
business, which
And
is
and dad
good.
too.
Yeah, and you're a dad too. So hey,
So
anyway. All right. Thanks a bunch.
okay.
We'll see you later. We'll see you this
Hey, thanks.
afternoon.
Yep.
All
Okay.
right. See you. Bye-bye.
Bye.
Hey, Jonathan. Oh, David. See ya.